Going back all the way to 2006, I took a trip to Guatemala through my church with a program called Impacto Ministries. We traveled there, we spent some time in the mountains, we built a couple of houses while we were there, and my husband, being a physician assistant as well, we both decided that we would set up kind of an impromptu clinic where we were working in Zuccobo. And we just found it to be a wonderful experience. The people are warm and welcoming and in very much need of medical care. We then decided we would take our whole family back this year, and we worked hard, raised money, called on various support from the hospitals that we work with to give supplies. So we had plenty of supplies to take with us on this trip. It ended up that we had 4 huge stuffed duffel bags full of supplies for the trip to set up a clinic. We didn't know how that was going to look. We just waited until we got there and kind of scoped it out and decided where we were going to set up this impromptu clinic, and ended up seeing about 180 patients in 2 days, and then another 2 days working with another program called Happy Tummies. Allergies tend to be a big issue in this area. It's very dry. They do have a rainy season, but we are actually in their winter season down there when we were there in February. So they were, the common cold, allergies, skin problems. We would see a lot of skin problems, and some problems we saw were a little more serious and needed referral to a local physician or the clinic. The only problem is that many of them cannot afford the cost that comes with going to a local clinic, and so this was completely free. We were able to go to the local pharmacy and get much needed medications, whether it was an antibiotic or maybe just a simple ibuprofen to give to them when they needed it. So healthcare in the area, there are physicians, there are clinics that they can go to, but there is a cost. It's about $10 a person, equivalent to our $10 for the patient to see somebody in the clinic, and many of them do not have that money to spend to go get help, to seek health care. So they don't go, and they just try to deal with things on their own, and some of their problems are quite serious. And I know of one patient that we saw who fell and broke her ankle and had a severe deformity of the ankle and really could have used some more medical attention. And we were seeing her 3 or 4 weeks after the injury, and so there was really nothing that could be done for this woman who didn't or wasn't able to seek medical care at the time of the injury. So we don't know how many patients are going to show up for healthcare. It's just one of those things that we just trust, and we set it up and wait and see who comes. And we set up, and there were families who were already showing up before we were ready to begin, and they were already lining up. And word spreads very, very quickly in these little towns around the lake. And so we had people coming. They take these little tuk-tuks, they're called, and we had people showing up in a tuk-tuk from 3 or 4 towns over because they heard that there were people here to provide medical care. And so we just set it up and saw whoever showed up and treated them best we could. My PA students from the Delaware campus, I had asked them I asked them if they would like to be involved in any way in helping to provide supplies, donating, medical supplies, whatever that may look like. And they got together and decided that they wanted to make blankets. And I thought that was a great idea because Happy Tummies has 27 little children children. And although we didn't take 27 blankets, but we were able to provide them with 15 blankets for their Happy Tummies program. And so they got together on their lunch breaks, and these students don't have a lot of time on their hands, but I had a handful of students who really felt compelled to help. They may not have the time to go and serve in these communities at the time, but they really wanted to help in some way. So they bought the fabric, and on their lunch break I found them in one of our other classrooms just tying knots and making blankets, and I helped them too, and they were really proud of what they did, and I was really happy to involve the students in this process so they can see that they can do this too, which is really what being a PA is all about. I mean, serving the underserved is where we came from, and I want to show them as a faculty member that I want to live by example, and so I want to show them that they can do this too. And so by getting them involved, I thought it was a great task for them for service learning. I really believe that teaching from the perspective of my clinical experience, whether it's here in the United States or any of the service projects that I'm involved in, I think is really important for the students to see. I think it's important for students to see that faculty will take on a task and see a need and be able to fill that or try to fill that or have a heart to fill that. And especially as a physician assistant, as a member of the faculty, I think that we need to be examples of that.